And yes, here in Europe, the barometer is pretty low this morning. As we left the apartment this morning, Florence said to me, she's not seen it so low before, and we're anticipating a big snowstorm, as they say in French, a tempête. So when Annie says it's early snow in Essex, I'm not surprised. Yeah. Just some real warm greetings to John, who has had to be off for a couple of days. Welcome back, John. Nice to see you. Miles, hello. Annie, gorgeous to see you. Ad, thank you. Chris Shipton, how are you today? Nice to see you. You look like you're in your attic under a Velux window. I hope it's comfortable there and warm. Vicky Doyle, lovely to see you. We always feel proud when we're showing Nazim's vids on our opening, and thank you for all that you and he are doing. It's great to see you. William, lovely to see you too. Louisa, wonderful. Phil, nice for you to join us. Thank you. If you want to speak at any point, just put just one line in the chat and I'll definitely make sure you come in. Be nice to hear from you, Phil. Everybody, James Ritchie has just made the journey from Geneva to his home in New Zealand, and he's in quarantine. We've been enjoying working with James and the team on COVID in cold environments. Just heard that there's a nasty COVID outbreak in a UK salad place. So it's another cold environment. Got to keep remembering that these places seem to be where the COVID likes to go and get settled in. So as Mohammed on the phone, welcome. I hope you're well. To Julian, thank you for joining. We know you've got to go off early. To Farhang, nice to see you. To Anne, I don't know where you are, Anne, but it's great that you've joined by phone. Thank you. Claudia Batts, thank you for joining again. Sitting next to me here is Catherine. Holly, I expect you're doing the school run, but it's nice to see you. Hope we will be able to focus a bit on some of the leadership issues. To Krishna Maramurthy, thank you for being with us. Jane Lawless, nice to be connected again. And Haruko in Tokyo. Yesterday, I took part in a big event organized by Naoko Ishii and others in Tokyo. Really interesting on what we're learning from COVID for dealing with the climate crisis and so on. Sarah Phillips, welcome. So really, really good indeed to be together again. And just what I want to try to do, and it may or may not work, is I want to try to see if I can share one particular thing, which is the latest state of the pandemic. And let me just see if I can do that. There we go. Yeah. I wanted to show you what we call the epidemic curve. And I do this sometimes because I think it's quite helpful to just see what's going on. And Catherine and I have been looking at this a lot. So this is where I'm moving my cursor around right now is the global case numbers on the left-hand axis and death numbers on the right-hand axis. And I mean, it's just quite extraordinary that each day now we're getting 500,000 cases reported from around the world. This is a load. I mean, what it reminds us is just the constant acceleration of the pandemic. Yes, it's slowed down over the last few weeks, and I'll explain why, particularly towards the end of November. In fact, I would have been absolutely amazed if it hadn't slowed down. It would have sort of confounded all my thoughts. But this other figure that is constantly on my mind is that 10,000 people are dying each day as a result of COVID. They're not all people who are going to die anyway because they were reaching the twilight of their lives. We're seeing data from all over the world that there are middle-aged deaths in most parts. And so I'm not going to in any way make light of this. And these milestones that keep cropping up, these are data from the 2nd of December. We haven't got yesterday's data yet. haven't landed in the inbox. But I know that the figures have passed 1.5 million people dying of COVID since the pandemic started. I'm just looking at Catherine, who's next to me. Am I right, Catherine?
Yes.
And because Catherine and I are every day looking at the numbers, we find this very disturbing and sad, unnecessary. There's a huge number of confirmed cases. But just looking at the shape of the curve, it's difficult to see on here. I was a bit frustrated that it doesn't come out right. That where we have to look is the top of the yellow bars. These are the case numbers, the top of the yellow bars. They're the cumulative case numbers. And we've just been going through a real acceleration in cases in the periods October and November. And that acceleration was because of the acceleration in Europe, what's been called by many the second wave. The case numbers were followed by a rise in death numbers. And now there's just been a peaking of the case numbers globally in the last 3 weeks. And that's because Europe, through dramatic movement restrictions and lockdowns, has managed to actually reduce transmission. Although the death numbers, again in Europe, are still rising a bit, they will drop down because that we know that it works. Your last ditch option or your last resort is just to stop people moving around, and that then leads to less disease. But as we've said in these sessions, time and time and time again, that is a really clumsy way of dealing with COVID because of its impacts on people and their well-being. If we go to the right of this picture that I've got on the screen, just note, please, that case numbers in the United States of America are continuing to rise and rise quite dramatically, with 150,000 cases reported approximately per day. Case numbers in the Russian Federation are rising, smaller. Case numbers in Italy have been rising. They've come down a bit, but the death rates in Italy are huge. Case numbers in Iran are continuing to rise. UK has just managed to peak a bit, but not some of the other Eastern European countries like Ukraine. Don't think that India has got away with things. They've still got quite high numbers, though they are reducing. So if we go and look at the deaths, you remember that was that big spike of deaths around the world in April, May, and then they came down and flattened a bit. And we wondered what was going on because they stayed flat through the northern summer months with small rise. But look at how they have risen again in the more recent weeks. And as I said, they're still a bit high. They haven't fully plateaued yet. And we look at this and we have to keep saying to everybody, this pandemic is still very, very active indeed. And we can be even more precise about the relationship between pandemic activity and what different countries are trying to do. Maria Van Kerkhove, the head of epidemiology and risk management at the World Health Organization, described to me during the last few days her absolute wish that we communicate at all times that a number of countries are doing really well in managing their COVID. They have adopted nationwide strategies to hold the virus at bay. They're defending against the virus. They're trying to keep the numbers down as low as possible. And they're doing that through having the whole of their countries on alert for new cases of the virus. And when these new cases are found, there is a strong reaction to these new cases. But when people are asked to isolate, they are isolated in a humane and supportive way. They're not forced to pay for their isolation. Their costs are covered. They are supported during their isolation. And They are made to feel they're part of a collective response. The 25 countries that are doing well on that range from South Korea, Singapore, Taiwan, New Zealand, Australia, other countries in East Asia, and then across into Africa, Senegal, South Africa, and then several countries in Latin America, on into Europe. It's Finland particularly, but other Scandinavian countries doing reasonably well, and then parts of Canada. It's not impossible to do the hold it at bay strategy in what we've been calling liberal democracies. It's doable. And if we add together all the countries, including China, that are following this strategy, they would cover about 15% of the population. Second group of countries, including many in Western Europe, the ones who've been hit by the latest acceleration, are what I call the ebb and surge countries, or perhaps we should call them the surge and ebb countries. The virus surges up and you get more and more cases, and there's more and more people wanting to get admitted to hospital. And then restrictions are imposed, various tiers of restrictions or degrees of restrictions, leading eventually to lockdown or circuit breakers in order to try to stop transmission. And then case numbers come down again. And then there's a release in the restrictions because for economic and social reasons, it becomes essential. And then the cases build up again. And then you have to impose the restrictions to get the cases down. So for example, in France and in the UK and other Western European countries, we're reaching the end of the second phase of restrictions. There's a release in restrictions, shops are opening and some degree of socialization is possible. And we anticipate, we might be wrong, that case numbers will go up again in January and perhaps February, and we'll enter then into the calls for a third round of restrictions and lockdowns, surge and ebb. And then the third group of countries that includes the United States of America is what we're calling the surge and surge countries, the countries that are going on having surges of cases. Now remember, because of the way in which COVID is transmitted, it's not a surge throughout the country. So if you look at the map of the United States of America, with 48 states out of 50 with cases, and a really constant report of increased new cases. For example, 200,000 new cases reported per day recently, up to 3,000 fatalities. It really is climbing up compared with where it was a week ago. That's a surge and surge country. Another surge and surge country is Brazil. Another one is Mexico, really dramatic. And then actually, I mean, it's difficult to be sure which are the other surge and surge countries, but I think it does include Turkmenistan, Tanzania, and others. These are countries where there has not been a systematic effort to try to restrict transmission throughout the country. So we've got 5 or 6 countries in that category, around 15% of the world's population. That may be an overestimate. Now in 4SD, our strategy has been very clear. We're trying to help the countries that are surge and ebb, the ones that come up and then go down and then up and then go down. We're trying to help them shift from being in that reactive state to being in a situation where they are well enough organized to be able to hold the virus at bay. And we've said that that requires a 7-step integrated response, which starts with having people at the center, where there's a big investment in trust building, where there's the build-up of a community-wide honeycomb of support services backed up by strong, and we mean that, strong public health capacity to be able to go in and suppress outbreaks when they occur, with localized incident response teams led by chief executives of local authorities, national support for that local capacity, that's number 6, And then number 7, a strenuous effort to actually link all the different levels together so they function as a real system. And we've looked at some of these hold it at bay countries, and time again, we come back with this sense that our hypothesis is not wildly wrong, that it's a combination of multi-level action connected through systems integration with really serious effort to involve people as being at the heart of the response, and then leadership that consistently reflects that, with our primary role model for this kind of leadership being the Prime Minister of New Zealand. But there are many others, and we go to Taiwan, we find the same leadership. We go to Singapore, we find the same kind of leadership. We go to Finland, we find the same kind of leadership. It's a leadership that really believes in encouraging the notion of one nationwide team rather than fragmentation and people bickering at each other. So that's what we've been doing. Now you might say, how come it's taken us so long to think this through? Well, it was because we wanted to try to find a way to explain to the executives of a large company that's really involved in this stuff what we think is happening, because we more and more think that there are business leaders that can help national decision makers to take the steps that are necessary to move into the hold it at bay capability. Why? Because the economy and society cannot fully recover unless the hold it at bay mentality is there, unless the steps are in place. And for us, this just is becoming more and more important, especially because we're looking ahead 6 months. We're looking ahead 1 year, and we really want to be sure that the world can go into 2021 with some kind of roadmap for what needs to be done. There's more to this. There's more to this, because during the last few weeks, we've seen how there's interest in vaccines coming on board, and we've been watching how vaccines have dominated the discussion. So let's look at some of the vaccine challenges. To get there, we have to go back to thinking through what hold it at bay means for a society. We said that it means that the people are in the lead. If the people are in the lead, what are they being asked to do? Well, at the moment, we're saying that they should do it all in relation to a number of measures that will reduce risk. Do it all, point 1, is physical distancing. We're not going to move away from that, being at least 1 meter and ideally 2 meters apart from everybody at all times, but particularly indoors in settings where ventilation is not good. I just think we have to hold on to that and not give that up. I know it's a problem for the hospitality industry. I know it's a problem for winter sports, but that's just the way it is. 1 second, is there a problem? No. Oh, good. Secondly, is protecting your face. And so we are now looking more and more at face protection. Thank you, Twee. We are wondering whether we need to be more fussy about the importance of 3-layer protection, which is what's in the WHO guidance. New WHO guidance came out this week. And secondly, some are saying combine a cloth mask and one of these surgical masks like this, combine them together. Well, let's see. But I do think proper face protection is really important. We have more and more data suggesting that those who wear masks are not only able to protect others if they happen to have asymptomatic disease, but they also can protect themselves. So we're keeping the face mask stuff going. And it was interesting to see that President-elect Biden is saying that he wants to go for a really strong invocation for mask wearing for 100 days after his inauguration. Seems quite sensible, thoughtful people there in the transition team. Thirdly, hygiene. So we're going to go on pushing for hand washing, cough etiquette, surface cleaning, and all those other elements, not just because they're great to stop COVID, but also they're good for reducing other diseases that are spread through contamination. Number 4, very, very important is isolation the moment you have symptoms of the disease. The moment you lose your sense of smell, gosh, you've got to get isolated. There's so much information now about how this virus not just affects our sense of smell, but when that's happening, probably that virus really is doing its big invasive work. And so lose your sense of smell, don't see anybody, stay out the way. Obviously, you've got to get tested if you can, but that's not the issue. It's just dealing with yourself when you think you might have COVID, because you're most infectious. More and more data says 2 days before your cough starts. And that's when you've lost your sense of smell. There are a few other symptoms that are thought to be important, but it's the sense of smell loss that is the real one. And this isolation must be done properly. John has been looking at quite a lot of information from around the world about isolation procedures. If isolation is not done properly, then it's really hard to break transmission. If you don't break transmission, outbreaks build up. If outbreaks build up, then very quickly you've got a really tricky situation on your hands. The whole skill for hold it at bay is to reach those spikes before they turn into explosive outbreaks. So isolation really matters. And then the last thing, and I'm going to go on about this a bit, is protecting those who are most vulnerable. Now, we don't quite know who's vulnerable when it comes to long COVID. So the arrival of long COVID into our consciousness means that we are much, much, much more worried about just letting this virus roam around. And the more information we hear about long COVID, the more we realize that it's not just a trivial thing. It's not just something that's psychological. It is serious damage to the lining of your blood vessels, to your respiratory epithelium, to your meninges and other membranes inside your skull. You know, this is serious. So you don't want anybody to get COVID, really. You just don't want it. And if they do get COVID, you want them to get it lightly, with light viral load, because long COVID is nasty when you've got it. And there's more and more data suggesting that that might just well set you up for nastier things to come in the future. Sorry to say this, but it's important. So you need to protect people who you're worried about, protect people with diabetes, protect people with hypertension, protect people who are older. And so putting in place those 5 do-it-all things, we keep saying that, is so, so important. Catherine was telling me, look, there's about 60% of people doing physical distancing and masking at the moment. Surely all we need to do is to find ways to push it up to 90, and then that would make a big difference. And I say, yeah, that's right. And I think the hold it at bay countries have put huge effort into increasing public involvement in such behavior. So we've now got vaccines coming on board. What's happened in the UK? Well, there's a thing called the Medicines and Healthcare Regulatory Agency. It used to be a European facility. And in fact, the British medicines regulations capability was used for Europe until the decision was made by the UK to leave the European Union. So the MRHA has been deciding what to do about the new vaccines, particularly the mRNA vaccine made by BioNTech and Pfizer. And they have decided to give an emergency use authorization for the Pfizer vaccine to protect older people and to protect people with other disease. I want to be very clear, they've not licensed the vaccine for general use. They've given an emergency use authorization for specific users. And that's very different from what's being considered by the European Union, which is a provisional license for general use. And folk have not understood that the UK procedure is a very specific thing that's allowed for vaccines when you think you can use the vaccine as an additional measure for prevention. I said you've got to protect old people and people with other diseases. So the emergency use authorization in the UK is for older people and people with other diseases and healthcare workers. that when we see people comparing what UK has done with what Europe might do or what the US might do, it's not comparing like with like. And so there's in a bit of a false battle being done. So I just wanted to say that because this vaccine that's about to be used in the UK, that's not going to stop the pandemic. It's going to protect a subset of at-risk people. And we will have to wait a bit till we can see what level and extent of vaccine rollout is going to be necessary to stop the pandemic. We don't even know whether the vaccine stops virus spread. So stop thinking that this vaccine is going to stop the pandemic. It's going to be an additional measure. The pandemic will require all stopping the pandemic will require all measures and will require vaccination at a very high level. And it will have to be global, and that will take 2 or 3 years. We're going to have to go on dealing with it through using non-pharmaceutical measures till then. James Ritchie, you've got to go off. I'd love to hear from you what it's been like coming back to New Zealand, and also the very specific issue of COVID in cold environments. Anything you want to say about that? Because it's something we've been looking at together, and it'd be jolly good to hear you.
Well, thanks, David. Just very quickly, yes, perhaps the COVID and cold environments we can save till next week, but I just wanted to report on the excellent experience that I'm having here in isolation in New Zealand. The welcome, the humanity from all of the hotel staff, the soldiers, the nurses, just everybody is in great leadership, and people are so committed. And committed to your health generally, regular health checkups, and so concerned about everybody's mental health when they're in managed isolation. And so there's a great deal of care about that. Also, a lovely note from a school pupil that was a piece of art that was handed to me as part of a welcome pack, you know, to say it may be scary, I know, but don't be scared. And you're doing a massive favour for New Zealand. We just want to say thanks. And it was just so lovely. And today, a soldier was screening me or accepting my particulars before I went to have my first COVID test since being here. And I said, oh, New Zealand's doing very well. And he was 18 or 20 years old. And he looked up at me and he said, I'm so proud. He said, I'm just so proud. And it was just such a nice moment. And so being here has been full of really lovely moments. And just in terms of humanity, it's been wonderful. So that's all I want to say tonight. Thanks very much for your leadership again, David, and see you all next week.
Oh, James, it's lovely. James sent us a text with the picture of this artwork that the young, I think this girl had done for him. It's so amazing, isn't it, the way everything has come together. I'll give you another example just while you're there. In the Irish Parliament, they had a very special session on will there need to be any kind of special quarantine arrangements for Santa when Santa is going around from house to house. And they had a session directly addressed to children who were worried about whether Santa's journey would be disrupted. And when James sent me the message he got, I thought, there's something special going on when you've got a government that can take care of people in this sort of way. James, you must be so proud, so proud.
I certainly am, yeah.
All Kiwis on this call, we just give a big shout out saying we're proud of you. I know there's one special Kiwi on this call besides James, and I want to say to that person, I'm really impressed. We've, in fact, just a little thing that in our list of 24 countries, there's New Zealand, Australia, and South Africa in there. It's nice that 3 Southern Hemisphere rugby paying countries have come out so well. We've been asking, does this mean anything? Not sure, but just wanted to say it. Thanks, James. Christmas coming up, you know, everybody will be thinking who whether or not you celebrate Christmas, but just because it is a holiday season in both hemispheres, you'll be thinking about practicalities. You'll be thinking about whether you ought to, if you're a fanatical skier, whether you ought to go skiing despite the enormous row going on in the Alps about whether or not ski resorts should reopen. You'll be thinking, should I try to squeeze through and see my loved ones? And one of our colleagues has been talking to her family about what this might mean. Twee, what have you been discussing with your family about Christmas, and what are the sort of issues that you've been thinking through? Over to you.
Thanks, David. And I think you mentioned one of the previous briefings that it's been quite different being Kiwi and learning about the response in New Zealand versus how it's being addressed in France. We have a family gathering coming up where there'll be households coming from different parts of France. And of course, I'm quite nervous about that. And what I've asked, or what I would like for us to consider, is how we can self-isolate, self-quarantine each household, so that if we do meet, that we are quite aware of the risk, and that it should be quite low when we join together in that one central location. It hasn't been easy to even say that out loud, and it's not very welcome. It sounds quite negative, but I think perhaps in a week or so, when we have a better idea of the situation, it'll be a bit easier to talk about. For me, not being super, not understanding how the French websites work, and the data doesn't go down to a very low level, it is very tricky for me, but I'm doing my best to make sure that we will understand the risks, and so we can celebrate safely.
Twee, thank you very much indeed. Those of us who live in this area that is at the border between France and Switzerland have a particular responsibility, because there is an awful lot of virus here. There's symptomatic spread, there's asymptomatic spread, and if we go from here to other places, or if we meet people, travel from here to meet people who come from other places, we have a particular responsibility, and it's super difficult. And when you actually hold out, like Twee has done, and say, look, I've got some concerns, others can get very frustrated about this. They can put a lot of emotional pressure on you to just soften up. Come on, it's not a risk really. And anyway, we won't come close to you, and all that stuff. And it requires courage, real big C courage, to actually resist and to say, well, this year we'll do it differently. This year we will manage some other way. And I want to really stress that we must all salute those with courage to do the best they can to try to reduce risk. Their actions might be minute in the totality of actions that are needed, but it is through individual choices that prioritize safety that it will be possible for these European countries that are in the surge and ebb pattern to shift to being hold it at bay countries. Just think about the collective energy in New Zealand that's surrounding James as he's gone there for his quarantine. It's a everybody in it together type approach, rather than saying those who are being careful are the odd ones, the ones we can point at, the ones we can really be, we can joke at them or something like that. It's a shift, and it's a palpable shift. And we see it again and again. Of course, rapid testing gives some opportunities, but even the rapid antigen tests that have come on speed recently, they have a false negative rate that is significant, and especially if you've got low levels of virus. So you can't have a quick antigen test done and say, oh, I'm free, I can run off and see the family with a clear conscience, because of the unreliability. We still don't have rapid virus tests. I keep hoping they will come, but they're not here yet. So those are our opening thoughts today. Haruko, lovely. I know you don't always like talking, but if you ever do want to talk, Haruko, we love to hear you, especially because it's really interesting what's happening in Japan. You are a country where collective courage in the face of threats is common. You're also a country where people don't always whinge whenever they're asked to do things. They tend to do it. Haruko, you've lighted it up. Thank you. Did you want to say anything? Because I'm going to answer your question, but I'd love to hear how you put it if you speak.
Hi, everyone. Well, I just put the comment in the chat box because we are experiencing the third surge, but well, we've made a great effort, and generally people follow the guidance of the leaders. And well, as I said in other briefings, people are wearing masks and washing hands, keeping distance, but still the COVID-19 cases are surging. So how can we make a balance between economy and the health? Yeah, it's difficult, really.
Well, in our group, we definitely put Japan into the keep it at bay category. You see, keeping it at bay doesn't mean you have 0 cases and it just stays there. You will get spikes, and you'll find that those spikes crop up as a result of particular activities, hospitality or factories or whatever, or religious services. But the key thing about a keep it at bay country is that when the spike is found, it's dealt with quickly, and it's dealt with by the whole of society, and it's dealt with well, without a lot of political toing and froing. And so we definitely have put Japan into a keep it at bay country, and we think it'll stay there. We've done the same with South Korea. Even though they do have the odd spikes, we put them in a keep it at bay country, because that's what we're really talking about. To be a keep it at bay country, you need the mentality that has the whole of society together to make certain that when the spikes do appear, they're dealt with. And you also do one very important thing, which is you make sure that the people who are involved in keeping it at bay are made to feel that they're heroes. You are a good person if you wear a mask. You're a good person if you go into isolation. And what you've told us, Haruko, is that that is very much the style within your country. Thank you for being with us. It makes us feel good. I mean, I know that there will always be, even in keep it at bay countries, groups of people who feel frustrated. I'm sure you've got some communities in Japan who are complaining, but by and large, the whole of society is coming together. Just check, I'm just doing a quick check. Am I right in what I have said?
I think so, but about the current surge, we'll still don't know the results, so let's see.
Well, let's see how the current surge goes. I mean, it should be possible to contain the current surge through everybody continuing to do the precautions that I've mentioned, and also if there's strong response from government. Let's see how it goes. I mean, in science, you're always wanting to prove your hypotheses wrong, so I'm quite happy if I'm shown to be wrong. I have to rethink. Marianne is saying something, and I think this is extremely important, your point, Marianne. Over to you.
Sorry, David. I spent 8.5 hours yesterday. I didn't stay for the whole of the UN General Assembly special session, but I listened to government speaking for 8.5 hours.
Wow.
The developing countries were saying that they used up their money with the first surge, and they're very, very scared because their coffers are empty. There was I normally am not a fan of Imran Khan, but he gave the most scary but excellent presentation of the whole of the time I was there. But this situation where the poor countries have no money left and they used it to help their poor people. And whether it is little Tuvalu or one of the tiny countries, big countries, they have nothing left. And it almost broke my heart when I was hearing what was being said. And it's one thing for European countries. We can keep throwing and throwing money at it, and we can increase the national debt above and beyond, and we can cut our overseas development assistance. But it's really the economic impact that's hitting so hard, and what needs to be done. Because obviously we can do what we can as individuals, as small groups, as NGOs. But this is so big and it's so terrifying. Thank you.
Thank you for saying it. I personally agree with you totally. The catastrophe for poor nations is not understood. And as the Prime Minister of Thailand and other Thai colleagues have told me, they can't take any more. They've got no money left. I've spoken to a colleague who's an advisor to the Minister of Health in Pakistan. He's given me exactly the same message. It's great that Imran Khan said this. And that's why we need to work, I think, intensively with the leaders of poor countries to help them to avoid being in the surge and ebb category and to shift into the hold it at bay category. It's super difficult, but the alternative will be that they'll have surges coming up in the next few months, and the economic cost of trying to deal with that surge is too great, and then they will get stuck. And we know that there are a lot of countries in that category already. So thank you. And I mean, what do we do about it? We have to keep talking about it. And it's one of the reasons why I was pleased that this UN General Assembly session on COVID has taken place at very high level, is just to bring that point out. Marianne, we need to think hard about what we need to convey in our advocacy. We're tiny little pinpricks, but if a lot of the tiny little groups can actually communicate it, it will be super valuable. More money into the coffers of the IMF to be able to give additional relief to poor countries is key. Just one thing about European countries, they won't be able to afford another lockdown. If we look at the financial situation for the UK and for France and for other countries this side, Spain, Italy, if they go into a third lockdown, the economic costs are going to be much, much worse. I mean, and what are the consequences for Europe going to be? Unemployment associated with collapse of businesses and major social tensions. So it's poor countries, yes. It's, I'm afraid, also the wealthy countries. Nobody in the world can really cope with another period of the austerity that comes with lockdown. So thank you for making that, and thank you for.
May I just say one more thing?
Yeah, come.
That as Europeans, we're not taking it seriously enough. Why didn't we cancel Christmas? Thank you.
I was mute when I made my reaction to that. I think we leave that for everybody. Phil, hello Phil, how are you doing? It's nice to see you again. There you are. You might want to indicate why you raised your question, and also tell people where you come from, Phil, because although I know, not everybody knows.
Okay, I work in a UK university heading up a international development centre, which is really where my question about Africa comes from. A fantastic graph, thank you for it, David. But it's interesting not really to see Africa on that graph. And I do worry whether we're just not getting the data, or you're not getting the data and it's just not showing up. Just quickly picking up on Marianne's point, Marianne mentioned the cutting of aid. That's been a big issue this last week in UK. I wish it was an even bigger issue. But now is not the time for the UK government to be cutting aid. It really isn't. It should be doing just the opposite. Been in touch with Claire Short this last week, who interestingly sends her best wishes to you, David. She remembers you well. And it's just really not the right time to be doing it.
Yeah.
I can't say more than that. There's blogs out on it. There's all sorts of stuff going around on it. But it really is an issue in the UK, and it's going to be hidden, unfortunately.
So Phil, couldn't agree with you more. I mean, Marianne and I come from the same sort of school, I think, and we came from different paths. I think it's so stupid, this chopping the aid program and making such a political point about it. You know, what? You just wonder where these decisions come from, just at the time when Britain could be really finding friends. It goes and does this, which will not lead to friends. Phil, thank you. Personally, I think there are surges happening. They're not big surges, they're spiky surges. We know that something's happening in Kenya from data from multiple sources. Our Kenyan friends on here are seeing it as well. But we're also hearing of trends in South Africa too. So the surges, I'm afraid, are happening. We'll get more information today. By next Tuesday, we will be in a better position because we have a check-in call with our colleagues from different parts of Africa in a few hours. Louisa Nofke, would you like just quickly, briefly, just to tell us your news, Louisa?
Yes, thanks, David. I was just responding to Twee. I was saying that I will be traveling next week to Germany to see my family after a year of not seeing them. And for weeks and weeks, I've been contemplating whether it's the right thing to do. And part of me does feel guilty for deciding that I want to travel. I'll be isolating in a hotel, both sites. First, when I get there, I have to figure out how to get a test so I can reduce the isolation period.
Yeah.
Then when I come back, I also have to isolate in a hotel to not put the people I live with at risk. And that is the greater financial challenge, actually, because to stay 2 weeks in a hotel in 2 different countries, yeah, it's logistically and financially quite heavy. But I feel my family at this point is worth that commitment and this challenge, that I wouldn't be happy if I chose otherwise, and then anything would happen, or yeah. But it's been tough, and I've been mulling it over and over and over to think, can I live with myself either way? Let's say. So yeah, thanks for giving me the opportunity to share.
Oh, thank you for joining us. Chris Shipton, please. Chance to show your screen if you want to, Chris.
Hello.
Oh, great.
Hey, a little news update is that we've made contact with the long COVID people, and we've got a date in a diary to do a workshop and a drawing for them. So that'll be nice.
Great. A long COVID infographic. Beautiful.
Yeah, we'll see how that goes.
What's your family, Chris? You're part of our family. Tell us about your family.
Well, I've got a younger sister who lives in London. I've got another sister who's just moved down the road from me, and my parents live down the road. So we're having an enormous WhatsApp conversation, which gets quite emotional at times, because my younger sister has been hit really hard by COVID, isolation, work troubles, the works. She's 25. And then, you know, my other sister, the school's been shut down several times, and it's my parents. My mum is incredibly reckless. My dad picks up the post with tweezers and isolates the letters for 24 hours before opening them, so they sort of balance each other out.
Yeah.
So trying to figure out what to do, it's pretty tricky at the moment, because we want to do the right thing, but we all want to see each other. So I think we're going to not have the full family Christmas. So
thank you, Chris. And everybody, this is some picture. Really is some picture. I wondered how you'd do it, and I'm so pleased. I think this is a Christmas present for all of us. Thank you very much, Chris. We're very, very, very grateful to you for being with us. Okay, let's go on to Anne von Bolowitz. I don't know whether you're here, but I think, Anne, it would be nice if we can get you to speak. Anne, can you unmute and say a word? Can't see. I think you might have gone off. So what Anne said is that she is also very, very concerned about. Oh, there's Anne. Anne, I just saw you. Come in, Anne, if you can unmute. Here you go.
Hi, everybody. Yeah, I hope it works, because I'm in front of a harbor on the Cape Verde Islands. Yeah. We've been traveling along the islands. Before leaving the Canary Islands, you do a COVID test. When you arrive, you go in quarantine. They really check, and it's so well organized. But then, as soon as you step foot on the on ground, and you get in touch, especially with the young people, because I think they are hardest hit by the COVID effects. You feel so sort of, not proud at all for, cutting development cooperation, and also for not having any tourism, no income, and people really rushing to the boat to ask, oh, can you please ask some more of your fellow people to come and visit our islands, because we are, our hands and our pockets are empty. So it's a very double, almost, it's a dilemma. In one way, I feel guilty to travel. On the other hand, I think it is so good to also see what it does to people, and especially young people in those areas. Yeah. So there is no, I think, good or wrong and right here. It's very difficult, David.
And thank you very much indeed. Thank you everybody for just illuminating the way in which COVID is revealing so many vulnerabilities and weaknesses. John, you want to comment? I sense from your body language you'd like to say something.
I was just looking at the sort of the practicalities of things, and how stories come out that give everybody, you put everybody on such a high, and then we sort of find afterwards the logistics of things make life rather more difficult. So we hear that everybody in care home staff and are going to get the vaccine, but the practicalities in a small care home of getting something at -70 into a fridge, and then staff come in on different shifts. Every time you open the fridge, you're worried about the continuity and does the thing survive? Is the vaccine still efficacious? So there's a lot of working through still to be done to make everything work, I think. And the headline stories are all well and good, and it's great, the messages that they bring. And then there's a lot of work that sits behind it in all of this, I think, David.
And just to add to that, John, thank you, by the way. Those of you who've read the press will know that this is a huge debate about how you immunize people in residential care homes with a vaccine that is still potent and has not lost its potency because it's warmed up. But the other thing that we I think, are really recognizing more and more is that the vaccine narrative is still needing a lot of work. It's not a silver bullet that's going to mean that we can just stop everything and say, whoopee, we can go back to normal. And just any of you do help us on that. Holly is I just got Jane Lawless, Iman and Holly, and no time left. And I want to give Twee a chance to come back, and we've got to finish on time today. So there's two comments on isolation, Jane and Holly. Jane, just make your point, if you don't mind, quickly. It'd be lovely to hear from you.
Hi, I better put my video on as well.
Thank you. Thank you. There you are.
Well, just quickly, really, it was a question that I'm really interested in the answer from what you know, David, is that the countries that are in the more keep it at bay, are any of those countries where people have been able to stay in their homes with their families? Because it seems that when we do that, the transmission within families is just going to extend the whole period. So I'm just interested in whether that's being successful.
So just in short, the WHO position is that actually isolation is best outside the home, supervised isolation outside the home. And most of the transmission that occurs in these surges is transmission in the household.
Thank you.
It's not comfortable. And John's been looking at the different protocols for isolation, and he's been getting quite focused on the problem of people having to isolate and then losing income. John, do you want a couple of seconds on that?
Yeah, well, what we're seeing is the people who most need, the reason why don't people isolate? Well, some people are just don't believe in it, but they're actually not the people that perhaps are most involved. It's people aren't isolating because of anxiety, because of fear, because they're going to lose income. They're living on a very marginal level, and we're not finding them, and we're not giving them the support they need in order to isolate properly. And that if we can get that support, where we find we can get that support to people, you know, really do want to do the right thing. And there's all sorts of support people need at these points. It might be about food, it might be about heat, it might be about income, it might be about debt counselling. There's all sorts of things, and the support is available to people in wealthier countries. But if we don't find the people who need it and don't get it to them in good time, then people simply don't find it possible to isolate, and we shouldn't stigmatise them for that.
That's why these community level honeycombs are so important, providing support, often one person per 50 households, different kinds of networking arrangements. We had a very interesting session with a group of NGOs who do support. It's a partnership that's been convened by the British Red Cross yesterday. It's fabulous work, but it's tough work. It's messy. And the people involved in it constantly feel they're not doing well enough. And we were discussing how you cope with the fact that you're constantly frustrated with yourself when you're trying to do this work. Super, super interesting. To Holly now, interesting thoughts on isolation, it says in my note from Catherine. So Holly, reaching the
morning.
Hello.
Just to support a couple of things. One is, yes, it is really tricky work at a local level, and those people are doing amazing work, particularly the not-for-profits. The thing about business and isolation for me is that if you want economic stability and businesses to be confident, you need to have a certain level of certainty, and helping them participate in the certainty, I think, is one of the important things. So making isolation visible is really important, because if you can get people to be proud of isolating, then they're more likely to do it. And if we can get businesses involved in making that visible, then I think that's important. So I've been talking to some of my contacts about trying to make both individuals and businesses be able to display in some way the fact that they're supporting isolation. And so if anybody else is thinking about that, I'd be really interested to know, and maybe we could work together.
Thank you so much, Holly. That's absolutely great. So Iman Ahmed asks if there have been studies about the relationship between viral load and long COVID. And actually, I don't have the answer, but I know that the studies are going on. It's a very, very important area. Are you more likely to get long COVID if you have a lot of virus? Are you more likely to get long COVID if you are exposed to virus over a constant period. So you're continuously taking it in before you develop the antibodies. And all that is going to come out. I'm sure there's going to be a lot in this, that the relationship between virus and the initial infectious dose on the one hand, and the nature of the symptoms and signs on the other hand, it's all to be discovered. And I think there's going to be a lot of new stuff coming through. So Iman, I will keep in touch with you if I pick anything up. Everybody, what a lovely session. We've enjoyed it because we'd spent a bit of time preparing for this one, quite honestly. And when our thinking has advanced a bit, we'd love to share it with you first. And very, very grateful to you for your reactions, to Twee and then to Chris.
So who's joining us today? We have quite a few people from different regions then on Tuesdays, so East Asia Pacific as well through there. Good spread across age range, mostly from 51 to 60 years old, and then most people optimistic and hopeful. One person there with the negative emotion, so thoughts to you and thank you for your honesty, and please stay connected. We'll be back here on Tuesday and next Friday.
Thank you, Twee. Can we highlight Chris's screen, please? Patrick, nice wave. Thank you. Very good. Chris, this is brilliant. I'm not sure about the call off Christmas part. We don't want anybody to think we're up to that. We're getting to second.
Okay, I suppose that's my little thing that I put in there. That's Alan Rickman in Prince of Thieves.
I think
for any cheesy 90s film fans.
Yes, yes.
And then that's John Bull in the middle, who's been my kind of go-to emblem of Britishness in many graphic recordings over the years. So,
Chris, we are so indebted to you. I can't tell you on behalf of all of us, whether it is the face in the clouds or your representation of the picture. So,
well, we love doing them, David, and you know, yeah, it's great to be a part of this. So, thank you.
If you do get to be with your family in some form or other, tell them a bit about what you're doing. And show them, if you haven't already done so, the pictures, and we will do a collection of them.
Oh, I just sent I just screenshotted the call off Christmas and sent it to my sisters on the WhatsApp just to rave them up.
You're a wind-up merchant, mate.
No, professionally so.
Professionally wind-up merchant.
I think that's you, Chris, not one of the bubble on Christmas Day then.
Yeah, well, I think that's the way we were going. So.
Everybody who's on the call, thank you very much indeed for joining us. We're a bit late. I don't think many of us want to go today. We know that. We look at each other and we feel immense solidarity. I'm looking just Haruko there joining us from Tokyo. Sarah, always you've been with us often. Marianne and Annie, it's great that you're joining us now. And Vicky, so much that you've been able to bring. Patrick, thank you. And just you might like to see waving Isaac and then Otto looking a little bit blotto. Hello to both of you. Let's see you both. There we go. Oh, great. Thank you very much indeed, Polly. Loy, thank you for being with us. Nice to be you. Anne, it was great that you joined from Cap Verde. And Mohammed, Farhan, Claudia, thank you. Anne Karen, nice to see you again. Really, really lovely. Sheila O'Sullivan, welcome. Noemi, great. And with that, I think I'm going to gradually close down because we've got something else to do, but I am going to look at my grandchildren.